This is our final session, and you're going to meet and hear very quickly, in sort of rapid-fire fashion, from 6 true game changers who are working to help the culture, the society, and all of us individually. Our first speaker is Dr. Robert Langer. I'm going to just sort of summarize some of the accolades and accomplishments of his life. They could really fill a long book. He's the David H. Koch Institute Professor at MIT. He's the founder and heads up the Langer Labs. He has 800-plus patents. His discoveries and inventions have started 17 companies. He is the most honored engineer and scientist in the country, 112 honorary degrees, 220 major awards, including the U.S. National Medal of Science. Forbes magazine and BioWorld have named him one of the 25 most important individuals in biotechnology. Discover magazine named him one of the 20 most important people in this area. Welcome, Dr. Robert Langer.
Thank you. Thanks so much. Good to see you. Thank you very much. So I wasn't sure exactly what to speak on, and I asked Randy what he thought, and he said, well, I should tell you how I got started and then tell you some ideas we're working on. So I thought I would try to do that. So I'm going to turn the clock back to when I was a graduate student. I was a graduate student at MIT in the 1970s, and when I graduated in the 1970s, just like a few years ago, there was this gas shortage, and the prices of gas kept going up and up. But it was actually even worse then. In the 1970s, at least if you lived in Boston, you had to wait in line if you had a car for about 2 hours to get your gas tank filled up. So I was studying chemical engineering, and the consequence of that is that if you were a young chemical engineer, you got a lot of job offers. And actually, I got 20 job offers from oil companies, 4 actually from Exxon alone. And that's really what pretty much all of my colleagues did at MIT. They went to, at that time, they basically went to petrochemical companies. And I remember I went to this one interview at Exxon in Baton Rouge, Louisiana. And when I went there, one of the older engineers said to me, you know, he said, if you could just increase the yield of this one chemical by 0.01%, he said, that would be fantastic. It would be worth billions of dollars. And I remember flying back home to Boston that night thinking to myself that I really didn't want to do that. I just thought it would be boring. And I had this dream. I kept thinking what I did want to do. I had this dream of using my background in chemical engineering to help improve people's lives. And I'd spent a lot of my time, actually, when I was a graduate student at MIT, helping start a school for poor kids in Cambridge. And I spent a lot of time, actually, developing new chemistry curriculum and to try to make science interesting for high school students and even grammar school students. And one day I saw an ad in a chemistry journal for being an assistant professor at City College in New York, where they wanted you to do that, develop chemistry curriculum. So I wrote them a letter applying for the job, but they didn't write me back. But I really liked the idea, so I looked at, find all the ads I could in all the journals for being assistant professor to develop new chemistry curriculum, and I found about 40 different advertisements. I wrote to all those 40 universities, and actually none of them wrote me back. So that wasn't working real well. It actually goes back, if you think about it, to some of the things that Norm Augustine said in that panel earlier today. You know, if you're not in the right box for education, you're not qualified. I mean, I thought I was doing okay, but I guess not. So I started thinking of other ways that I might be able to use my education to help people, and I thought about health-related research. So I actually applied to a lot of hospitals and medical schools, and they didn't write back either. And then one day, one of the people in the lab where I was working said to me, he said, Bob, he said, you should write to this surgeon in Boston named Judah Folkman. He said, sometimes he hires unusual people. He thought very highly of Dr. Folkman. I won't say what he thought about me. At any rate, I wrote to Dr. Folkman. He was kind enough to offer me a position. And I began working on 2 projects. They were actually related. The first one was to try to discover the first substance that might stop cancer blood vessels from growing and therefore stop tumors from growing. And the second was to develop plastic systems that might be able to slowly release these potential molecules, drugs, and other large molecular weight substances for a long period of time. Now, before I worked on these problems, no one had been able to develop ways to continuously deliver these substances for a long time. And in fact, scientists at the time, in the 1970s, they thought this was impossible. Just to show you a quote in the literature. So I'll just read you this. This is what was written around 1977. They were describing this idea of moving drugs through plastics, and they said it had to be a small molecule, no larger than a few hundred. One wouldn't expect that large molecules like proteins could be released because they couldn't get through, the permeation rates were so slow. So actually, the only thing I really had going for me is I hadn't read that. So I started, and I didn't know it was impossible, so I started to work on it anyhow, and I experimented kind of Edisonian-like, and I experimented with all different kinds of ways. I actually found over 200 different ways to get this to not work. But eventually, I was able to make these tiny little microspheres, and here's a picture of one of them. Here's it cut in half. And we showed that you could use this to release all kinds of substances for hundreds of days. And that enabled us actually to ultimately discover this substance that would stop blood vessels. I should point out that, as an aside, it took 28 years from our discovery of that these substances existed and developing the assays to having the first drugs on the market that could stop blood vessel growth from occurring. So that didn't take place till 2004. But today, this is just a list. They're now, some of these are some of the biggest selling drugs in history, like Avastin, and they're used for treating all kinds of cancer. It's like a whole, there's really now, the FDA talks about 4 ways of stopping cancer, you know, by therapy: chemotherapy, drugs, surgery, radiation, and then this, angiogenesis inhibitors. And they're actually useful not only for stopping cancer growth, but also stopping macular degeneration, which is a leading cause of blindness, also caused by abnormal vascularization. At any rate, about 2 years after I started, we can turn the slide off for a second. About 2 years after I started working on this project, I got asked to give a talk to a very distinguished group of scientists in Michigan. It was a big polymer talk, and actually I'd never given a big talk before, except actually in 8th grade. And that talk didn't go real well. I remember in 8th grade, I spent the night before, it was only a minute and a half talk, and I spent 4 hours the night before in front of my parents' mirror reciting this talk over and over again. And then the day came, and I gave the talk, and I started reciting it. I didn't bring up a sheet of paper or anything, but I started reciting it. And for the first minute and 2 seconds, I did all right. And then I could not remember the next word. And I stood up there frozen in front of my 8th grade class for another minute until my teacher finally told me to sit down and gave me a not very good grade. I think it was an F. And so ever after that, I really wanted to do whatever I could to avoid public speaking. And so when this Michigan talk came along 2 years later, I stopped working about 2 weeks in advance of the talk, and this was a 20-minute talk, and I kept practicing my talk over and over into a tape recorder. And finally the day came, and I got up and I gave the talk. And at the end of it, I actually thought I did all right. I didn't forget too much what I was going to say. I didn't stammer too much. And I thought when I was done with the talk that these scientists, older scientists being nice people, that they would want to encourage me, this young guy. But when I got done with the talk, a whole bunch of these scientists came up to me, and they said, "We don't believe anything you just said." They said, you know, it's just like that quote you saw. They said that these molecules are never going to be able to get through the polymers. And it wasn't until several years later, as scientists began repeating what we did, that the question shifted to how could this possibly happen. In fact, I spent a good bit of my time at MIT early on understanding the mechanisms, which has to do with creating very tortuous networks in these plastics to do that. Also, another thing that's very important when you're a professor, about shortly after I gave the talk, I tried to write grants to the National Institutes of Health and other places to support the research. And I remember my first 9 research grants were turned down. The reviewers actually weren't real nice either. They were often very, very negative. I remember one of them turned me down. They said, "Well, how could Dr. Langer do this? He's a chemical engineer. He doesn't know anything about biology, and he knows even less about cancer." I wasn't sure how that was possible to know less than nothing, but I guess that happens. Anyhow, when I was done with my postdoctoral work, I applied for faculty positions in a number of chemical engineering departments, but I had trouble getting jobs at the time because all the chemical engineering departments felt what I was doing wasn't engineering. They thought it was more like biology. So I ended up joining what was then the Nutrition and Food Science department at MIT. But in that department, what happened was the year after I joined, the chairman of the department left, and a number of other senior faculty sort of took control, and they decided to give me advice. and their advice was I should start looking for another job. So there I was, getting my grants turned down, people not believing in my research, and it seemed like I wouldn't even get promoted to the lowliest, to an associate professor. But fortunately, within a few years, various scientists in the pharmaceutical industry and different universities started using a lot of the techniques we developed. All kinds of products kept being developed. I'll just show you that on the next slide. These are all now FDA approved they're all like those microspheres that I showed you before, but they're used to treat, and they're very widely used. They've treated many millions of patients. They're used to treat prostate cancer, endometriosis, type 2 diabetes, alcoholism, schizophrenia, and so forth. So they've had, I think together probably about 20, 30 million people have been treated with these. But you always keep thinking of ways that you can do better, so I thought I'd tell you a couple new things. In fact, Novo was talked about before today, and they actually made a video on one of the new things we're doing on nanotechnology. So we're actually now developing nanoparticles that can go right to a tumor and hopefully kill it. It's still experimental, but we are in the earliest stages of treating patients. I thought I'd show you a video on that Novo did actually on what we're doing.
He starts with a nanoparticle of anti-cancer drug. That gets encased in a plastic that releases the drug over time. That, in turn, gets a special wrapping that disguises the package as a water molecule to fool the body's immune system. And last but not least, the address where it should be delivered, a key that will only fit the lock of cancer cells.
Now, I should point out that a lot of the clinicians I work with tell me it doesn't really blow the cell up quite like that. But it gives you the idea, and in what we published last year on the first trials, these are CAT scans showing you tumors that exist before we gave the drug, and then here you see this is the lung, and they go away within 42 days. Here's another example before and going away. So now we're doing much more advanced trials. We've done about 35 patients so far. That's been one area. Second area that's kind of futuristic that we're developing, we're actually making drug delivery chips. And just to show you an example of that, this is just a prototype. But what you can see is we have these little wells, and they're covered with gold or other metals. And drugs can be stored in here. We can even put sensors on these chips. And actually, I even brought a big version of one. This is actually one with you. It actually has an antenna printed in the back that actually you can communicate with a cell phone or a BlackBerry or anything like that. And so the idea is that we actually did the first clinical trials in Denmark a little over a year ago. And the disease we treated was osteoporosis for women, where they have to take parathyroid hormone, where they take shots once a day. And you need to take the shots. You don't want continuous delivery, or it would make the disease worse. Now, normally, 75% of the women who have this don't keep taking the shots, because who wants to do that? But that's a terrible disease. So what happens is we can actually have a signal that's just like the way you open up your garage door, but it's a special radio frequency just approved by the FDA and the FCC, and that signal makes the drug come out when the woman's sleeping every single night. And we did this for about 4 months. And you can envision this for all kinds of situations where you might want to have a pharmacy on a chip, like many drugs being delivered when you want to, and so forth. Now, this is very early. It's just started human clinical trials. But I think it could change the way we do things. And you can, like I say, even put sensors on these so you can detect signals in the body and someday tell the chip how much to deliver. Now, the third and last area I wanted to go over is another idea we had, which is tissue engineering. Could you someday take cells, put it on a polymer scaffold, grow it, and make a new tissue? And this has already now been used to make new skin for patients who are burned and who have diabetic skin ulcers. I'll show you some pictures rather quickly. This is a little boy, very badly burned. You can take the product, which are the neonatal skin fibroblasts, on a polymer scaffold, put it in the child at the time of injury, come back 3 weeks later, look at how much better he's doing. Six months later, he's pretty much healed. Well, that's okay. And so that's just an example. Like I say, these are approved. We're also working on ways of making new body parts. We have a project with the Army, the United States Air Force, the United States Armed Forces Regenerative Institute. And here, we've actually been working on ways of making new body parts, like new ears, they're not being used yet, but this could be used for soldiers coming back from Afghanistan or Iraq. So here's the ear. Here's a high-powered scanning electron micrograph of the fibers and the cells. Ultimately, you'll get pure, this will all be filled in. This hasn't been put on patients. It has been put on rabbits. And even though it has not yet been put on the soldiers, we've actually, Jay, my colleague, has actually done trials where he's actually made new chests for a little boy like this and other things. I'm sorry, and other situations like this boy wants to play baseball, but if he got hit in the chest with a baseball, he could die. The very last example I want to give you is paralysis. And again, this is still in animal trials too, but someday I think it could be used in patients. We hope we're not that far away. So we actually made scaffolds with neuronal stem cells and a polymer. First, let me just show you a control rat 100 days after he got the injury. And the key things to notice are that the paws are splayed in a rather awkward way, and also he's not able to support his own weight. But if you give these rats a scaffold with the cells on, we'll go to the next animal, he does much better. We actually did 50 of these animals, so it's quite reproducible. And so this animal, even though he's heavy, is able to support his own weight, as all 12 of them did in this study, and the paws are splayed in a much more normal way. We'll just watch that for another few seconds. Most recently, we've actually done now primates. There's a company in vivo therapeutics see the pause, that's doing primates, and I thought I'd end the talk with that video. So here's the monkeys. These are African green monkeys, and you can see if with the injury or controls, he's not able to move his leg well, but in a second, this will start up, and he's got the scaffold and the cells, and he'll do much better. And again, all these they're not cures, but they're all examples of how we're trying to use science and engineering to solve some really big problems that I hope will change the world. Nanotechnology in one case, smart delivery systems with a chip in another, and finally this whole idea of regenerative medicine and tissue engineering, which could someday promise to make all kinds of new tissues and organs. So thank you very, very much. It's been an honor to speak to you.